I would just like to open saying that I'm a clinician. I am a doctor. I am the one who is actually trying to bring all of those AI, technology, medical, scientific, also public health, news, developments, progress to an actual patient. And this is one of the biggest bottlenecks. We need policies, we need governance, we need support in terms of translating healthy longevity to populations, not only to specific circles of people, but also we need a better way to bring it to the people and to scale. And so I just wanted to mention a few things. One of the things that is important is that health span or healthy longevity is not only for healthy people. It's not making somebody who is healthy better and optimal in his and her performance. It's of course one of the goals, but health span is also for people who had cancer, who have autoimmune disease, who are chronically ill, on plenty of medication. So it's not only the gap between lifespan and health span, which is about 10 years as we speak, but also the threshold. How much of a health span can we help you? How much can we do to improve without breaking the point? Being one of the longevity physicians around the world where, I'm globally active, we build a healthy society of longevity medicine for doctors, I'm getting the calls when the stem cell infusion ended in a paralysis in a 30 years old, or when a hyperbaric made somebody blind because of the strokes in the occipital area. So we see that part of the hype. That's why it's very important for us to bring the credibility to the right people and to communicate and to increase the education and the literacy of health. But just from the perspective of pure economy, you've probably heard the term longevity dividend. What it basically means, and there is a very good peer-reviewed publication on that from Professor Scott, calculated that only in the US, one healthy life added to a population would urge about $38 trillion for the country. And very similar simulations have been done by McKinsey Health Institute for other countries. So it's actually probably the best investment for any economy and GDP for every country. And so right now, health span, as you can see, the examples in China, in Abu Dhabi or UAE, Saudi Arabia, where it's Singapore, where it's a national program, I think health span becomes not only a policy, but also a national competitiveness part and very futuristic way of making sure that people not only live healthier longer, but they also are active, and not even just in terms of the workforce, the entire communication about retirement and so on. It's not about that. If you are healthy, you consume. And most of this calculation for the 38 billion was actually for the consumption. So that's very important. Now, talking about AI in that case, we are really trying, for example, in our departments, the first and still, sadly, the only department of healthy longevity in a public academic hospital that we have, where we've seen in the last 3 years 2,500 patients for free, building data sets that can enable them to see their health trajectories, how they evolve over years, and what are their priorities in order to make them feel better, live better, which medication, which supplements, which lifestyle interventions, how much, and at which point of time they should do. And that should scale to health insurances. And as your colleague mentioned before, I am very excited about one of the news that came out a week ago. AI is helping us not only in building the data, generating data, making sense out of it, creating health trajectories, but especially in bringing therapeutics into life. And this was also mentioned in our last speaker's very, very good mention that AI can help us not only to treat diseases faster by AI-generated new targets that translate to medications. It takes time, but instead of 12 years, it took 18 months to develop, for example, this one for an incurable disease of idiopathic pulmonary fibrosis where people just stop breathing at some point of time. And most of those medications right now are already in phase 2A, phase 2, so close to humans, and they target aging and disease. So hopefully also at some point of time for those who are not sick, there will be some sort of therapeutic that will help just to reduce the pace of aging that comes together with disease.